Okay, perfect. Well, good morning. So you should have all just heard the automated announcement that this meeting is being recorded. The recording will be made available to the public, and therefore, in order to ensure a quality recording, we ask that everyone please mute their phones at this time and remain muted unless wishing to speak. Also, to assist in making the recording more clear, please announce your name each time that you begin to speak. So I will kick it off with attendance. So Barbara Cass.
Good morning, Nicole. Present.
Hello, Barbara. Lita Orfici. Let's see, Matt Barrett.
Present.
Judy Dowd.
Present.
Hi, Judy. Good morning. Mag Morelli.
Present.
Mairead Painter.
Present.
Michael Morris.
Present.
And Claudio is excused. Senator Moore. Oh, hello, Lita. I see Lita just joined us.
Sorry, I'm late.
No, no problem. We're just
Oh,
getting
look,
started.
Barbara Cass is here. Barbara.
Barbara, you're on mute.
I worked out all my computer issues all by myself.
See, you are tech support. Good for you. Representative Abercrombie. Senator Berthel. Representative Case. Senator Daughtry Abrams. Representative Steinberg. Senator Summers. Senator Wong. Representative Pettit. Senator Austin. Representative Walker. Senator Minor. Representative France. Okay. I know we have a competing committee today, so we may not have a lot of folks in attendance. Moving to distinguished guests, Commissioner Gifford. Commissioner Jitani.
Present.
Deputy Commissioner Aaron. Guy Wolstein, who I know will be joining us shortly. I don't think he's joined yet. Bill Halsey. And Lisa Conley. I don't know, Mag, is she joining?
I don't think she's joining us this morning.
Okay.
That was
So-
just from the last meeting, Nicole, when
Oh, was that? Okay.
previous meeting when she was here as a stand-in for Mag. So she's just on the list perpetually.
Okay, gotcha. So we'll move to those who I did not announce. Could you please state your name? So I see Owen is present from OPM.
Hey, morning, Nicole.
Good morning, Owen. And Betsy and Nick from DSS, I see are present.
Thank you.
Sue from OPM.
Morning.
Good morning, Sue. Let's see who else I may have missed. Emily Shepard, I see is present.
Good morning.
Good morning, Emily. And Tyler Anderson. And let's see. So we'll get to phone numbers and then I'll ask if I have not stated your name just to announce yourself. So who is on the phone number 860-490-7629? Maybe I'm mute. Okay, so moving to 860-550-5197.
Hi, good morning. This is Hillary Felton Reed.
Oh, hello, Hillary. How are you?
Good, thank you.
And then moving to 860-921-7817.
Larry Santilli, good morning.
Oh, hello,
Oh, here.
Larry. How are you?
Hi.
And then I see Ken Prisby just joined us. Good morning, Ken.
Good morning.
And anyone who I have not announced.
Jonathan Fink from CLA, representing Leading Age.
Good morning, Jonathan.
Morning.
Okay. I think that's everyone. So moving to the agenda, let me just bring that up. So the first item that we have today on the list is the right sizing plan submissions, just to provide an update for that. So nursing homes should be seeing within the next week to 2 weeks, they should be receiving their letter for their right sizing plans, approving, asking for modification or a denial of their plans. As a reminder, nursing homes were asked to submit a plan back in April of this year. Those plans were to address efforts to kind of take a look inward and look at opportunities to be able to right size, rebalance, how to do long-term strategy planning. So nursing homes submitted those plans. We have all that detail posted to the DSS website. I can share the link in the chat. And then the department has reviewed, and then we will be reaching back out with individual letters to each of the nursing homes, discussing their plans with them individually. So nursing homes should expect that again within the next week to 2 weeks. So any questions on that? Okay, so seeing none. So Barbara, Lita, I'm not sure who's taking the next.
I'm going to defer to Barbara. This is about
Okay.
survey, correct? Yep.
Yes.
Thanks.
Thanks, Lita. So good morning, everyone. Typically, we give during these meetings a quick report on how many immediate jeopardy findings we have had since we last met. As we noted in our last meeting, we had been seeing an increase in the number of immediate jeopardy situations. And just to remind the group, an immediate jeopardy situation is anything or any situation that has the likelihood or the probability to cause a life or safety issue in the environment. Typically, we see about 12 situations a year. And this past quarter, we have seen 19 situations. And they are connected to different issues. It's not that we're seeing falls, and in all 19 of these situations, it was a fall with a significant injury where staff didn't fulfill their responsibilities. It's in lots of different areas. We're seeing significant med errors. We're seeing issues with following the care plan. We've seen issues with failure to follow a person's advanced directives and administer CPR. But we're keeping our eye on this. It concerns us that we are seeing this increase. And we have met with MAG and MAT, which was very helpful, and they've reached out to their members to share their concerns that the department has as well. So I will stop there, Lita, if you think I should add anything else, or Nicole, any questions, or will we wait till the end?
I think because we have a little bit of a short agenda, if folks want to ask some questions now, we can do them now, and then also if folks, I see Representative Pettit has his hand raised.
Barbara, I'm sure I just got in. I'm just wondering if any of the problems that you've seen have been related to staffing issues per se, or if not overall staffing, the seniority of staff, whether there was inadequate nurses, CNAs, et cetera, if it relates to numbers per se, or if it goes deeper than that.
So in some of the cases, so good morning, Representative Pettit. In some of the cases, we have seen a nexus to staffing, but we can't unequivocally say that it's related to inadequate numbers. it is kind of all over the place. It could be inadequate staffing numbers. We're seeing issues related to training and the failure of the facility to provide the training to that individual. We're seeing issues with staff just failing to fulfill their responsibilities. Adequate staffing could be in place, but for whatever reason, the staff person has just, and I'll use this loosely, but has just decided to go off in a different direction than what the care plan has indicated should be done.
Yeah, I just want to add, I mean, yes, and so there's a certain part of this coming out of COVID and needing to get back to basics, you know, back to routine, back to policies and procedures, regular training modes and things like that. And what we're finding is, you know, some facilities are just not doing that as well as others. And so some of what we're seeing, you know, like particularly around med errors, you know, that's not necessarily a staffing issue as much as it is, you know, someone failing to do their job. And so I think those are the most troubling type of things that we're seeing is when, you know, staff either at the leadership level or boots on the ground level are just failing to do the things that they're supposed to do to care for residents.
And a quick follow-up, if I might, hopefully on a positive note, given the emphasis over the past 2.5 years on infection control and infection control nurses, have you seen a decline of sorts in terms of infection-related issues, given the emphasis on infection control in the last, say, 6 months or a year?
So in this past quarter, I don't believe any of those deficiencies were related to infection prevention or infection control. I think the legislation that was passed last session was incredibly helpful. And it does require, as we all know, that each facility have an infection preventionist on site and actively working with staff. So I think that has helped immensely. We are continuing to look at infection control on all of our surveys. The HAI unit within the department is still actively working with nursing homes. We're still doing our long-term care COVID huddle between the facility licensing and investigation section and HAI weekly. We talk about facilities that are experiencing a little bit of an increase. We met last night, so we're still actively in infection prevention, infection control, COVID mode at the department. So I hope that answers your question, Representative Pettit.
No, thank you very much. Much appreciated. All your hard work. Thank you.
May I just add one other small comment to that? Everything that Barbara said, totally agree with, but I think our COVID numbers in long-term care really speak for themselves in a way. I mean, do we have rises when there's rises in the community? Of course, that's sort of, there are patterns that happen. What happens in the community happens in the nursing home as well. But I think that this is something the industry as a whole and with DPH, like Barbara said, our hospital associated infections unit has really worked hand in hand with the industry. And I think this is one of the strongest things that's actually come out of COVID. So I would say that's an area actually that I would say is of strength in long-term care right now is all the emphasis on infection control.
Mag?
Yeah, I just wanted to follow up. I just wanted to comment how much we appreciated the dialogue with DPH when they realized there was an increase in IJs and they contacted the associations. We had, discussed it with us. We were able to communicate to our members. So we truly appreciated that communication and working together with them on that. And then I just also wanted to comment on the work of the HAI unit. They have been extremely helpful to the nursing homes, very collaborative when it comes to infection control. We've had some major changes with CDC, CMS guidance. They not only held calls with the infection preventionists, but they've put out written documentation to help them guide them through this and put it all on one resource paper. So they continue to meet monthly with the infection preventionist. So I just can't, I just really wanted to sort of praise the work that's being done in that area with our nursing homes.
Maybe and Bill Pettit, if I can ask one more thing, maybe too much in the weeds, but with the COVID variants out there, certainly what we've seen clinically is a lot of people with very mild or even asymptomatic cases where they've tested due to exposure, or tested due to a runny nose. I had it myself three months ago, and if it wasn't in the COVID era, I would have just considered it a small cold and not done a thing. Are the nursing homes in general case finding fairly aggressively when people have cold or URI symptoms? Do you think, and I know this may be for DPH, maybe for MAG, or are they following an aggressive policy, or is it different from home to home in terms of looking for cases and trying to prevent further spread in that way because of the symptoms, which are very mild in some people?
Well, I can speak. The homes originally were, because we're in a high community transmission, we're doing twice a week testing of unvaccinated staff. They were doing, screening tests. They were symptom screening all the visitors. This has recently changed. CMS and CDC changed that guidance. There is still passive screening, so people are still asked not to come in with symptoms. And if any staff have symptoms, all staff are educated. If they have symptoms, they are screened, tested, any kind of symptom. If they have any kind of respiratory illness, they're to wear, full source control PPE. There's a difference, I know, between PPE and source control, but they're supposed to, wear it all at all times, even if it's not COVID. So there's pretty aggressive screening and reporting, right? So everything is reported from the nursing home perspective.
Same true for the patients. If they have mild symptoms, are they pretty much universally tested?
Yes, and they, CMS has just really emphasized that recently, that residents, you're always supposed to be monitoring them on a daily basis for any change in condition, any symptoms. So they're aggressively screened.
Thank you.
We're pushing heavily right now on vaccine for residents and vaccine for staff, the bivalent booster. And I think we're waiting to see reported numbers. Certainly the vaccine mandate last year and then last winter helped to push the vaccination rate among staff in the 80%, in the 80 percentile, which was really helpful. We're not sure that we'll see the same kind of numbers for the bivalent booster. We are pushing heavily for resident vaccine, though.
Thank you. I know Mairead mentioned that she has a hard stop at 10, but I did want to give the ombudsman an opportunity to report out on anything that she's seeing in the nursing home. So Mairead.
Thank you, Nicole. So to Barbara's point, where they're seeing a lot of an increase in the IJs, we're seeing an increase in abuse, neglect complaints, and what we're seeing as far as quality of care in the nursing homes. This has been a little bit of an increase, I would say, over the past 4 months. I don't know if it's related to staffing. We have seen staffing in some of the buildings improve in some areas, and it's not across the board. So it tends to be pocketed. It is related to supervision at times and what we're hearing back from family members and other residents, as well as evenings and weekends tend to be a more challenging time from what we're hearing. So we're trying to do outreach and education. I've met with some corporations globally with their directors of nurses and administrators to talk about the concerns, what we're seeing, and the feedback that we're getting from residents and family members. We're hoping that helps. And I think Lita said back to basics. We did have our annual Voices Forum, and that's actually what it was titled this year, was Back to Basics. We talked about some areas of focus and ways that residents could use their voice to communicate what their needs were, and care planning and having those individualized needs met. With the new guidance that's out from CMS related to nursing homes around residents' rights, transfer discharge. I think that's a big piece. I want to make sure that all the buildings know about the transfer discharge that must come through our portal now. We're seeing that as a little bit of a challenge. We're trying to make sure we're educating all of them that as of July 1st, all involuntary transfers and discharges must come through the portal. And there's I would say a better definition of what a facility initiated transfer or discharge is in the new guidance, and that we're really going to be paying close attention to that. So that's sort of where we are right now. We're hoping that with some outreach and with some support and education that we'll start to see some improvements related to quality of care and residents' rights.
Thank you, Marie. So any questions from the ombudsman while we have her?
Thank you.
Seeing none, moving to the next topic, receiverships, closures, and bankruptcies. So reporting out, we have one nursing home, Westport Rehab Complex, which has submitted their letter of intent to close, so they are in process. And then Grove Manor and Waterbury has also submitted their petition to close, so they are in process of closure as well. And then we have one nursing home which remains in receivership and 0 bankruptcies. So any questions? Okay, seeing none, moving to the next topic, update on the case mix, on the transition to case mix reimbursement or acuity reimbursement. So as folks know, and I'll again put links in the chat for reference, we transitioned nursing home reimbursement to acuity. Acuity reimbursement will essentially throttle the direct care component of the Medicaid reimbursement and adjust based off the resource need of the residents. So essentially, the sicker the resident, the more resources needed to take care of that person, and then the reimbursement throttles up to cover that cost, or it will adjust down if the person requires less resources. So we transitioned the system on July 1st of this year. The rate will adjust quarterly. So we just went through our 10-1 quarterly adjustment. Nursing homes will receive a rate letter each quarter, just updating them on where their rate has shifted quarterly. So nursing homes should expect their quarterly rate coming out to them shortly. We are also layering into acuity reimbursement a quality component. So quality will become a major factor in how nursing homes get reimbursed. So we are currently working with the industry, actively working with Matt and Mag, and I completely invite you guys to chime in here. So we're working very closely together on what the quality components will look like. DPH will be joining our conversations in this, and we're meeting monthly to discuss this. So right now the meetings are with the DPH, DSS, and the industry, and then what we'll be doing after the first of the year is doing some public facing discussions with the industry and with folks in the public and the representatives, and we can report out through this forum as well on how those discussions are going. But essentially, we're looking to utilize the CMS quality measures, so since those are kind of tried and true measures, and they've been around for a while, and nursing homes are already familiar with reporting out through those CMS measures. So we'll be utilizing those measures, incorporating them into the system. We're very much at the beginning stages of what the quality will look like, but come July 1st of next year, that's when the rate will start to fluctuate based off of quality. So the Medicaid reimbursement will adjust according to quality then. But again, we're very much at the beginning stages of what the system will look like. So we'll definitely have more to report out as the discussions continue and as we start to solicit public feedback and have more large stakeholder meetings. So Matt and Mag, I don't know if you guys wanted to chime in as well.
Sure. First of all, I just want to comment on how transparent the process has been and collaborative. It's been extremely open, and a really good discussion has been had. We've been meeting on a regular basis. I think the theory and the goal of the program is excellent. I mean, we're trying to drive quality, right? So we're trying to drive certain quality in certain areas of quality. It's being developed by the state so that it can be flexible and changed. So if one year we're working because we see we have an issue with pressure ulcers and we're trying to drive quality in that area, but the next year we see a different area, we can change the quality measure we're using to gauge people, to measure people. So I think that's great. I mean, we're having very good discussions about really trying to get a system that is really really incentivizes the providers and therefore is beneficial, of course, to the residents. We've brought in some, both Matt and I have brought in some experts from the outside who've done it in other states, because most other states have this kind of program. And that's, I think, where Myers and Stouffer, our consultants that DSS have been extremely helpful, like amazingly helpful. I mean, they're just, they know how to do this and they know how to create these different ways to measure things. So I think that's an excellent resource for us. And the one thing that I think that from a provider perspective, we'd like to see, and this will be something that'll be at the probably debated in the legislatures, we'd like to see the program working from a unique new pool of money. So it's not, it's not a withhold, taking from people and then redistributed, but really a pool of quality of money that's intended to be provided to people who are providing quality care and truly an incentive. So I think that's the area that we'll be pushing in the legislature next year, but really looking forward to seeing this be put in place. And like I said, it's being designed in a way by the state so that if we put it in place and we see there's a glitch or something's not working the way we thought, it can be easily changed. So that's also helpful, because you hate to get stuck with something that's in place that's just not working the way you thought it was going to.
Thanks, Mag. And also piggyback off of that too, is that part of the system is we'll be incorporating in a consumer satisfaction component as well. So currently Connecticut, we don't have really any mechanism of getting the voice of the consumer, the voice of the resident and the family. That doesn't necessarily come through in a quality measure. So what we've been doing is discussing with Dr. Nick Castle, who has developed this consumer satisfaction survey called CoreQ. And what CoreQ does is it's kind of a short survey that can be for the resident or for the family or for both to fill out and kind of give feedback on what their experience was in the nursing home. This is a survey that's used in several other states. Actually, CMS is also in discussion on utilizing CoreQ on a national level. So it's kind of one of those better consumer satisfaction surveys that are out there. So we've been in discussion too with Dr. Castle and his group about incorporating CoreQ into our quality program. But that would be something that we would have to kind of get a baseline on and incorporate it in, say, in July of next year, start to get feedback on the consumer satisfaction, and then start to build it into, as Mag mentioned, the system is very flexible, so we could build the consumer satisfaction survey into the quality system to start then throttle the reimbursement once we kind of have a baseline set. So I know getting the voice of the resident and the voice of the families is very important to this program as well. So that's why we've been in discussion with the folks over at CoreQ and factoring that into our quality program. So we'll definitely have more on that, which we'll be reporting out in the future. Also want to give Matt an opportunity to chime in if he had any comments as well. Matt, I think you're still with us, Matt, if I'm not mistaken. Maybe
Nicole,
not.
No, hey, Nicole, the only other quick thing I'll say, we are going to be talking about both of these efforts, acuity and quality, at Friday's MAPOC meeting. That'll be for a broader audience. So nursing home experts in this call probably won't learn that much, but that'll be an opportunity for us to educate and update key members of our community on these efforts. Just want to give that a call out.
Thank you, Guy. So Any questions on case mix acuity quality? Okay, seeing none. Moving on to the next agenda item, we need to vote on the 2023 meeting schedule. So Melissa had sent that around. I don't know if folks had a chance to review, if there's any questions regarding. Sure.
I can show it, Nicole, if
Okay.
that would be helpful.
Yep. Yeah, thank you, Melissa. And I think too, since these meetings always have historically been on Wednesdays, that's what the 2023 schedule is in keeping with as well.
Mm-hmm.
So I will make a motion to adopt and then open for discussion.
Looking for a motion or a second?
Second.
Second. I'll second that.
Thanks. So any discussion regarding? Okay, so hearing none. So we'll take a vote. All in favor of the 2023 meeting schedule? Please say aye.
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 Awesome.
Aye.
Any opposition? Any abstentions? Okay, hearing none. Well, that was easy. I think that was probably the easiest item we have today. Okay, so we have officially adopted our 2023 meeting schedule, so thank you. Melissa, I'll turn it to you for the annual committee report.
Yeah, so that it's that time of year again when we are going to need to put the final touches on our annual report to the legislature. We're going to keep the same format as we have in previous years since we are required to report on the outcome of our meetings. That's our actual charge. So I will be going to DPH and DSS with the annual data request to just update some of the data that's not up on the public facing websites regarding nursing homes. We update that front section with our data portion, and then the back will just be what it typically is, which is brief summaries of each of our meetings, outcomes, and the top issues that were covered over the course of the year. And as we've done in the past, I'm just flagging this for you at this meeting because we'll do what we did the last 2 years, which was the draft report gets circulated. I ask people to please send me comments within a week or two. The final report goes out, and then what we've typically done, because we don't meet again before January 1st, is we've just done an electronic vote where everybody has just said, yep, looks good. So just flagging for everyone because we do need active participation in the electronic vote. That's it.
Thank you, Melissa. Opening up to other business, if anyone has any questions on anything we discussed today or any other topics they would like to bring up, a kind of opportunity to open the floor and let folks chime in. Right, group today. And Mag, I think we lost Matt, so that might be why we're so quiet today.
Can I just comment, because this is a financial advisory committee, and
Yes.
you know, we recently had July 1, we had a 4.5% rate increase to go towards staffing. And we were allowed to provide it to staffing, so not just direct care, but people like housekeeping and dietary. Everybody knows the current workforce crisis we're having. So that type of increase was greatly appreciated. I can tell you, having done a recent salary survey, the increases are significantly higher. So all you know, that people have had to give to staff. So people are trying, resources are going towards staff at all levels. But it is really something that, you know, that's really a pressure point for nursing homes, but people are working at it. I was glad to hear Mairead say that she's seen improvements in certain areas of the state in the staffing, but we are working on it. We're working with the State Office of Workforce Strategy. We're working with several other initiatives that are going on with workforce to try to develop the workforce. But employment, recruiting and retention is just critical. So just so you know, everyone is really, that's kind of the focus right now, working to maintain our staffing levels that we have and to increase them. So thank you for that increase. We'll be back for more.
All right, Nicole, it's Matt. I was able to join by way of another number. I would like to just have an opportunity to quickly comment if that's possible.
Oh, of course, Matt, go ahead.
Well, I just wanted to, I guess, follow up on Mac's comment that the industry continues to be very concerned about the inflation that is present in our environment and cost increases, especially in the area of staffing, that are not currently reflected in our rates. And because this is the Nursing Home Finance Committee, it's definitely an area that we need to continue to pay hyper attention or hyper focus to because of the financial instability that it has a lot of potential because of those issues. I was just reading a report that home heating oil, in New England could be up as much as 17%. And there's a whole range of, if you're a nursing home buying oil at 20,000 gallon increments, these are very significant cost increases. And while, I guess it's a statement of the obvious, but I do want to get on the record that, we see cost increases all across the economy. Anybody who's been to the grocery store and bought a loaf of bread recently, understands inflation. But nursing homes, like other businesses, especially nursing homes that are highly reliant on Medicaid, have no ability to increase the prices that they're paying to consumers. So when their costs go up, they're not able to, increase their prices. Like, perhaps 3 months ago, a loaf of bread that we're buying was $4, and now it's $6. You can send an example of that in my own household budget. Nursing homes have no ability to do that. And so I wanted to continue to express concern about inflation and cost increases in the sector. I also wanted to relate that to the ability regarding the industry to be successful at recruitment and retention. I do want to shout out that Governor's Office of Workforce Strategy is moving on some very important initiatives, and they're moving at a rapid pace regarding CNA training. We're grateful for that. I think it'll make a difference. And certainly, I think that one of the most important things that has happened in terms of creating stability in the area of recruitment retention was the 4.5% rate increases associated with the wage and benefit enhancements. But when you look at the inflation out there, that you can easily see that our employees are losing ground, even with a 4.5% rate increase related to wages and benefits. Even as generous as that was, and as grateful as we are for it, I think we're going to continue to need to, or we're going to continue to see pressure on the system. And I did want to have the opportunity to comment on that. Thank you.
Thank you, Matt. Mag, I had a quick question. You had mentioned that you just did a salary survey of your members. So what were you seeing? Was it compression that was kind of happening, or was it seeing, as Matt kind of suggested, competition from other sectors of the healthcare industry? What was kind of the results of what your members were seeing?
Well, the salary survey shows just the levels of payment. Average, and above, and it's actually going to be released next month. We have to wait 3 months, to actually release the numbers, but we're just showing significant increase in the amount of the wage level that is needed to hire someone. So the entry level is increasing dramatically. And then of course that is causing all others to increase, because you can't just increase your entry level, right? You're increasing the other. So we're seeing dramatic increases in entry level. And in the new positions, we're seeing dramatic increases in salary. Nurses, tremendous increase in the wages. And once we release this, we certainly can discuss it with you in more detail. It's just certain rules about when you can actually release the numbers. So.
Okay, no, that's helpful. Thank you, Mac. So any other questions, any other items of business folks would like to discuss? Okay, seeing none, I will make a motion to adjourn.
Second.
Yes.
Thank you, Barbara.
Trying to find my microphone.
Barbara's doing tech support today, so she's got it down. All right, and with that, we are officially over. So thank you all very much for participating today. And if
Thank
there's
you
any
all.
other additional
you.
questions, you know where to reach us. So thank you.